Hey, yo, it's Bebo the Great, and welcome to Disavowed. It's been a little while. How's everyone been? Merry Christmas to all. The story this evening I have for you: asymptomatic transmission of COVID-19 didn't occur at all. A study of 10 million finds. Wuhan, China, this story is coming out of, dated December 23rd of 2020. A study of almost 10 million people in Wuhan, China, found that asymptomatic spread of COVID-19 did not occur at all, thus undermining the need for lockdowns, which are built on the premise of the virus being unwittingly spread by an infectious asymptomatic people. Published in November in the scientific journal Nature Communications, the paper was compiled by 17 scientists, mainly from the Hanzhong University of Science and Technology in Wuhan, but also from scientific institutions across China, as well as in the UK and Australia. It focused on the residents of Wuhan, ground zero for the COVID-19 pandemic, where 9,899,828 people took part in the screening program between May 14th and June 1st, which provided clear results as to the possibility of any asymptomatic transmissions of the virus. Asymptomatic transmission has been the underlying justification for lockdowns enforced all across the world. The most recent guidance from the Centers of Disease Control, the CDC, which states that the virus can be spread by people who don't have symptoms. In fact, the CDC claimed that asymptomatic people are estimated to account for more than 50% of transmissions. UK Health Secretary Matt Hancock also promoted this message, explaining that the concept of asymptomatic spread of COVID led to the UK advocating masks and referring to the problem as asymptomatic transmission. However, the new study in Nature Communications titled Post-Lockdown SARS-CoV-2 Nucleic Acid Screening in Nearly 10 Million Residents of Wuhan, China debunked the concept of asymptomatic transmission. Instead, stated that out of nearly 10 million people in the study, 300 asymptomatic cases were found. Contact tracing was then carried out of those 300 people. No cases of COVID were detected in any of them. A total of 1,174 close contacts of the asymptomatic positive cases were traced, and they all tested negative for COVID. Both the asymptomatic patients and their contacts were placed in isolation for 2 weeks, and after the forethought, results remained the same. None of the detected positive cases or their close contacts became symptomatic or newly confirmed with COVID-19 during the isolation period. Further evidence showed that the virus cultures in the positive and re-positive asymptomatic cases were all negative, indicating no viable virus in positive cases detected in the study. Ages of those found to be asymptomatic ranged between 10 and 89, with the asymptomatic positive rate being lowest in children or adolescents aged 17 and below. The highest rate found among older people older than 60. The study also made the realizations that due to a weakening of the virus itself, newly infected persons were more likely to be asymptomatic and with a lower viral load than earlier infected cases. These results are not without precedent. In June, Dr. Maria Van Kerkhove, head of the World Health Organization's Emerging Disease and Zonas unit shed doubt upon asymptomatic transmission. Speaking at a press conference, Van Kerkhove explained, from the data we have seen, it seems to be rare that an asymptomatic person actually transmits onward to a secondary individual. She then repeated the words, "It's very rare." But despite her word choice of rare, Van Kerkhove could not point to a single case of asymptomatic transmission, noting that numerous reports were not finding secondary transmission onward. Her comments went against the predominant narrative justifying lockdowns. And at the time, the American Institute for Economic Research highlighted that she undermined the last bit of rationale there could be for lockdowns, mandated mask, social distancing, regulation, and the entire apparatus, compulsion, and coercion under which we have lived for the past 3 months. Swift to act, the WHO performed a U-turn. And the next day, Van Kerkhove then declared that asymptomatic transmission was really a complex question. We don't actually have an answer yet. I think that the misunderstanding to state that asymptomatic transmission globally is very rare was referring to a small subset of subsidies, she added. However, the new Wuhan study seems to present solid scientific evidence that asymptomatic transmission is not just rare, but non-existent. Given that it found no evidence that the identified asymptomatic positive cases were infectious, the study raises more important questions about the lockdown. Commenting on the study, the conservative Treehouse noted that all of the current lockdown regulations, mask wearing requirements, and social distancing decrees are based on the complete fallacy of false assumptions. The evidence presented in the study shows that very rare actually means never. Asymptomatic spread just does not happen ever. Such a large scientific study of 10 million people should not be overlooked, Jeffrey Tucker argued in the AIER. It should be huge news, paving the way to open up everything immediately. Yet media reports have been virtually non-existent and ignored. A fact that Tucker explained. The lockdown lobby ignores whatever contradicts their narrative, preferring unavailed anecdotes over actual study of 10 million residents in what was the world's first major hotspot for the disease we are trying to manage. The recent findings should enable society to reopen once more, according to the AIER. Without asymptomatic transmission, the whole basis for post-curve flattening lockdowns, life should resume. We could take comfort in our normal intuition that healthy people can get out and about with no risk to others. We keep hearing about how we should follow the science, Tucker added. The claim is tired by now, but we know what's really happening. He closes commentary with the question, with solid evidence that asymptomatic spread is nonsense, we have to ask, who is making decisions and why? There you have it, ladies and gentlemen. America and the world in the end of 2020. Are we all being duped? What is the reasoning behind it? Imagine if we had a real contagious disease that was 10 times more deadly than the coronavirus. What measures would the government go to then? And would the people bend their knee and stay inside and never leave their house? What could be next for us on the horizon? Could we be mandated to wear helmets, little bubble helmets around our head while we go outside? I am Beeble the Great, If you have not already done so, go subscribe to my YouTube channel, Disavowed Podcast. I can also be found at disavowedpodcast.com. You have all been disavowed.